and welcome to Talk to the Experts here on News Talk 770. I'm Betty Jo Kaiser, and joining me this hour is Diamond Fernandes. Diamond is the director of HeartFit Clinic here in Calgary. Their website is heartfit.ca. You can reach them by calling 403-870-4348. That's 403-870-4348. Hello, Diamond.
Hello.
How are you today?
I'm doing excellent.
Diamond is always doing excellent. He's the picture of health and vitality and vibrancy. I love seeing you. How are things? Everything's good?
Everything's very well. Yeah, absolutely.
Excellent, excellent. For those folks that haven't heard, that don't know, can you tell us a bit about your clinic, the HeartFit Clinic here in Calgary?
Yeah, the HeartFit Clinic is a cardiac rehab and heart attack and stroke prevention clinic. So we see people who have heart disease or are on the path of a heart attack or stroke. So that's our prevention side of things. So we want to see people that, if they want to find out what their risk is of a heart attack or stroke, that's our of course, a big population that we see. But then we see people on the rehab side of things. So people who've had a heart event, that could be, irregular heart rhythms or a heart attack or, it could be heart failure or some kind of congenital issue that they need to be addressed as well. So, yeah.
So cardiac rehabilitation as well as prevention. And you guys do some really fantastic assessments at the clinic.
Yeah. And I really love the assessments that we do because, when you go to your family doctor, there's some certain things that they can do to see what your risk is of a heart attack or stroke. Yet heart disease still continues to be the number one cause of death of men and women and hospitalization of men and women here in Canada.
Yeah, that is a staggering statistic. Like I didn't realize that until I met you and gotten to know more about the HeartFit Clinic. Number one killer and number one cause of hospitalization of men and women.
Yeah.
So it's not breast cancer. In fact, it will kill more women than all cancers combined.
Yeah. And
that's a staggering statistic.
It's kind of scary. And
it really is.
Yeah. And I think when we have a socialized kind of healthcare system like we do, unfortunately, it can't do everything.
Right.
Things going to get missed. And so I think doctors do their best to kind of help you as much as they can. But that's why then they refer to clinics like us, because we can get into more detail. And that's the beauty about that aspect of it, is that when you go visit your doctor, they can check some small things to see where your risk is. But
cholesterol, blood pressure.
Even then, I'll get into cholesterol a bit. But those are important things. Don't get me wrong.
Good basics.
Good basics. But okay, even if they send you to a cardiologist, right? And a cardiologist, they're very good at what they do. And on a preventative level, they can do some quick screening test to see where your risk is of a heart attack or stroke. Now, many listeners out there might have had what we call an echocardiogram, which is an ultrasound of the heart. So that looks at the structure and function of the heart. What looks for coronary artery disease, when we're talking about heart attacks and cardiovascular disease from that perspective, they can do a stress test. And a stress test is only designed, there's two options after a stress test that can happen. I don't like any of them. And so, and not to be bold about this, but it's true. Either you're giving the patient a clean bill of health after a stress test, or you're sending them on to further testing. And that's things where I necessarily don't like it as well. So when you have a stress test, if it only shows advanced stages of disease, what I mean by that is that if you look at a blockage inside an artery, the artery has to be blocked about 80% or more for it to show up on a stress test. So if you have 70% or below stress test, like a blockage, then it's not going to show up on a stress test.
It won't detect.
No.
Really?
And so you're sitting there now having a clean bill of health, yet you can still be on this path of a heart attack or stroke. And I mean, it's been almost a couple of decades I've been doing this now for. But anyway, the point is that the amount of people that I've seen have had a stress test and then come see us after because they've had a heart attack or something is astounding.
So what can the HeartFit Clinic do to learn more? What are your assessments?
So what we do is we see, is to look at artery health and function.
Okay.
So we do a test where we do an ultrasound. We look inside the artery, right inside the artery of the neck, right? And what we do is we measure the very first two layers. We measure the thickness of that arterial wall, and we come up with a cardiovascular age. So we determine what is the age of your arterial wall. So if you're 50 years old, we want to say, okay, your arteries are about 50 years old. However, your arteries can age faster than your chronological age. So if you're 50 years old and I tell you, look, your arteries are, actually 65 years old, well, that's something then we can do to then reverse that disease process, because that's where our expertise lies. And I'll get into that part of it as well. So we do that test. We do another test where we look at the reactivity and function of the arterial walls. So it becomes very important to look at, okay, well, how well are the arteries functioning? And so when we restrict blood flow and then restore blood flow to arms, to the arms there, that's what we do with another test. We can see how well does the blood flow return back to the fingers and see what the reactivity is of the arteries.
Okay. So your assessments are remarkable. Like, it's not something, you have a bigger toolbox than the family doctor or even a cardiologist would have. And once you're able to determine people's heart health, then you have a wide range of things you can offer, including exercise programs, nutrition, stress management. You guys have the full suite of what people need to get their heart healthy.
Exactly. And so if someone's on this path of a heart attack or stroke or actually have heart disease, then we have some great treatment options that are non-invasive, non-surgical, safe, painless. It's a quick, not a quick fix, but it's not like a quick fix, and we'll talk about that in a second. But the point is that we can then help patients grow new arteries and improve the health and function of the arteries. That's really what we want to focus on then.
And one way to do that, and we're going to hear more about this throughout the hour, but I have to mention it right off the top because there's only one place in Alberta that you can get it done. It's at the HeartFit Clinic, and that's ECP, External Counter Pulsation Therapy.
Yeah.
There's only one place, and that's the HeartFit Clinic. And you're listening to Talk to the Experts here on News Talk 770. I have an expert in heart health joining us today, Diamond Fernandes. He's with the HeartFit Clinic. Their website is heartfit.ca. You can make an appointment and have a conversation with them. 403-870-4348. That's 403-870-4348. Or if you're outside of the calling area, 1-877-700-4348. That's 1-877-700-4348. So, Diamond, next steps then.
Yeah. As part of our assessments, is something that I really want to talk about, I want to get back to in a second here, is the cholesterol. And many people think, okay, well, cholesterol is the reason why I end up with heart disease and whatnot. And it's actually not the truth fact. Is really we want to look at inflammation. Right. So with a HeartFit Clinic, we also ship our blood work that we do. We ship it down to the States to get it analyzed, basically with more detail. And so what I mean by that is that cholesterol comes in two different shapes and sizes, or different shapes and sizes, we'll call them. But to keep it for, a simple thing that we can picture on the radio, you have basically golf balls and you have tennis balls. And if you imagine that the artery is protected by a tennis net, tennis balls will not go through a tennis net and cause problems. It's the golf balls that will. And so when you go to your doctor, what they're measuring is golf balls and tennis balls all in one. So when we look at cholesterol, the bad cholesterol, LDL cholesterol, the loser cholesterol, it's not all that bad. Because the tennis balls, now you have someone on a preventative level that's being prescribed a cholesterol-lowering medication when they shouldn't be, because they have high cholesterol, but they actually got larger size, so they're not at risk. Or you have someone who has normal cholesterol, and then they should be prescribed or, get in focus aggressively on their cholesterol because they have golf balls. And that's something that then gets dismissed from our regular blood work that we can do here with our services here. So
the HeartFit Clinic really does their assessment is much more in depth.
Yeah.
And you're just able to take a much closer look.
Yeah. So in combination, we look at artery health, we look at function. We look at your blood work with a lot more detail. We look at key things and factors in your blood. We look at different things where you might be deficient in so that we can tell you where your risk is of a heart attack or stroke or reverse the disease process, more importantly. And, another important thing that we do as part of our assessment, and I feel and that's why we do it as part of our clinic, is exercise is the best medicine. And, I don't know, how many doctors truly prescribe lifestyle changes versus, just getting the prescription pad and writing a simple medication.
Yeah, it's true. We need to be told and heard. It's always from outside sources.
Yeah.
I shouldn't say always. I mean, my family doctor is a big believer in getting out there and getting moving, getting active.
Absolutely.
But the HeartFit Clinic, you guys have programs set up. You work one-on-one with people, and you really take individual care of people. Because it just depends, right? If we're talking folks that might have angina, people that have a history of heart disease, you kind of see like people from all the wide range, right?
It's a personalized approach to people's heart health, and we're seeing people one-on-one, so we have the ability to do that. And it's a long time. Like our assessments, they'll go for about 3 hours long, and
Wow.
and
Very thorough
consultation afterwards. So I mean, we're here for you. We're here to help you prevent and reverse heart disease with more detail. So
we, of course, is the HeartFit Clinic here in Calgary. Heartfit.ca is the website. Call them at 403-870-4348. That's 403-870-4348. Outside of the calling area, it's 1-877-700-4348. We do need to take a break. We are going to come back, though, and find out more about how you can improve your heart health. Hello and welcome back to Talk to the Experts here on News Talk 770. I'm Betty Jo Kaiser. Joining me this hour is Diamond Fernandes. He's with the HeartFit Clinic here in Calgary. Heartfit.ca is their website. You can reach them by calling 403-870-4348. That's 403-870-4348. Or outside of the calling area, 1-877-700-4348. That's 1-877-700-4348. Welcome back. Now, at the top of the hour, we talked a little bit about assessing your risk for heart disease and prevention. What the HeartFit Clinic really offers is incredible therapy programs. Once you have assessed the individual and you know where they're at, what's next? This external counterpulsation therapy, it's a big focus of the HeartFit Clinic. Part of the reason it's a big focus is because it's the only place in Alberta where people can get this treatment.
Yeah.
Before you folks opened, people had to fly down to the Mayo Clinic or the Cleveland Clinic, and it just wasn't available. It is available here at the HeartFit Clinic in Calgary, but what's really important to know is that it is not brand new. It's not something that's just been invented. It's FDA approved, and it's used the world over.
Yeah, it's really cool. I mean, I always smile when I talk about this treatment because of the benefits that happen from the patient's perspective. You get improved blood flow, you get improved cardiovascular function, you get improved, what we call ejection fraction. We can see improvements in the function actually of the heart pumping blood.
Okay, cool.
When you improve blood flow, so many good things happen.
Before we get into exactly how it works, I just want to talk about who it's good for. So folks with angina and heart failure, people who are not amenable to heart surgery or procedures such as heart stents. We've all heard about stents. When is a stent appropriate?
I feel that I think stents are good for patients who are actually having an emergency event.
It's an emergent response.
Yeah.
It is a Band-Aid to somebody that is in an emergent situation.
Exactly. And I think that's where the best outcomes are with that aspect of it. Now, it's also good for patients who have what we call unstable angina that's bringing them to the hospital. So if they have, unstable chest pains or it is enough pain to bring them to the hospital, but they're not having a heart attack and it's not going away, but they're not, that's where a heart stent would be a benefit to people. If you're getting chest pains and you want to find out what your risk is, I think they're doing, in my opinion, too many, and I'm not talking about Calgary, I'm talking about all over the place where people are doing heart stents on patients that are walking into the hospital on their own volition.
Yeah, that's
in my opinion, there's better ways to treat heart disease than that. Because your arteries are not a pipe. It's not something that we can just go in there and Drano out or,
stick a brush and squish it out.
In there and squish it out. Your arteries, if you take your hand and make a circle, that's what the inside of your arteries look like. It's skin. And if I took something
flexible,
abrasive,
it's malleable.
If I took something that was abrasive to the skin, it would inflame or it would start to get red. And that's where the process of heart disease happens, or atherosclerosis, or plaques start to build up in our arteries. And so a heart stent, in my opinion, it should only be done on an emergency level. That's it. That's the only time I see that a benefit. If it's non-emergent, external counterpulsation is a much better treatment option for you.
Okay, so how does external counterpulsation work? or ECP to make it easier.
ECP. So external counterpulsation, or ECP, it basically works on, it's a non-invasive, non-surgical, painless treatment to help people with heart disease. So what happens is patients lie in a bed and they have these blood pressure cuffs on their calves, their thighs, and their buttocks, and it sequentially pumps blood up to the heart, and it's timed to your cardiac cycle. So what happens is that when the heart contracts, these cuffs on your legs relax. And when the legs relax, the heart relaxes. And so during the relaxation phase, what we're able to do of the heart cycle is that it's able to pump blood back up to the heart, and then every contraction is pumping a greater volume of blood out to the whole body, including the heart itself. And so what happens is that we see the process of what we call angiogenesis, which is the growth of new arteries. We see improvement to the health of the artery. Remember, we're not taking something foreign and going to brush it out or something like that. It doesn't work that way. Your arteries, like I said, are not a pipe. It's a muscle. Your arteries are like a muscle. And so what happens is that that's the counterpulsation. So when your heart contracts, the cuffs relax. When the cuffs contracts, the heart relaxes. And so it almost acts like an auxiliary heart, and it's happening every heartbeat.
Cool.
And so if your heart's going about 60 beats a minute or whatever beat it is, that's how quick the machine's going back and forth. And you lie in this bed for an hour each time, and the benefits of this treatment are amazing. I mean, I got so many stories I can share with you, but patients who are waiting for bypass surgery, if it's non-emergent, right, and this is... Let me get into this right off the bat. Patients who have what we call left main disease, which is an artery that's blocking two major arteries, I think bypass surgeries are very important. But people who are waiting for it, this is a much better treatment option to start first. And I don't know, just the person I am. If you gave me a choice, we got a surgical option over here and a non-surgical option over here. Which one would you want to pick?
You're going to pick the non-surgical one every time.
And
for
so,
sure.
And it works, and we see some really great results with it. We're taking patients off of bypass surgery lists. And that's a big deal because obviously there's always a risk to surgery.
Absolutely. You're listening to News Talk 770's Talk to the Experts. I'm Betty Jo Kaiser. Joining me is Diamond Fernandes. He's with the HeartFit Clinic. Heartfit.ca is their website. You can also reach them at 403-870-4348 or long distance 1-877-700-4348. I'll repeat those numbers later. So you've explained some of the benefits that you see in people doing ECP. And you've also talked a little bit about the advantages of ECP over other treatments. What are the advantages over, let's call them, alternative treatments such as chelation therapy?
So chelation therapy is, a lot of patients will try and go out and do chelation therapy. Chelation therapy is designed to remove heavy metal toxicity inside the vessels of the blood itself. Okay. And there are a few trials out there that are showing some good support for this. And that's improving the idea is to improve the health of the artery. It's not, I think it gets a negative connotation to cleaning out the arteries. It doesn't do that. But it definitely stabilizes what we call plaques, in my opinion, based on what I've seen with patients that do it. Now, we don't do that in our clinic. The benefits of ECP therapy, or external counterpulsation therapy, is that it grows new arteries. The idea is that it improves the health of the function. When we improve blood flow, so many good things happen. There's a reason why I recommend exercise is the best medicine, and it's truly the best medicine out there. When you have, if you're taking medications, that's great for heart disease. That's fine. But when we compare those medications to even benefits of exercise or lifestyle changes, you'll never see that. I go to the conferences every year, many times a year. All these blockbuster trials come out and say, okay, this medication is the next best thing or whatever it is. The point is that they'll rarely compare it to aggressive lifestyle changes, which is what we do at the HeartFit Clinic, or external counterpulsation. And with external counterpulsation, we're able to improve blood flow so much that so many good things happen with that.
Are there any risks from doing ECP?
So what happens is when we do an assessment with our clinic, our nurse will go through, obviously, your history and everything. There's a very small percentage of population that we will not do ECP on. And those are patients who have an extremely high heart rate because of the pumping back and forth.
Right.
That can be solved perhaps with obviously a beta blocker, which is something to lower your heart rate with, that's the case, or a very abnormal heart rate, again, above that level there. So those are some people. And then those people who have very severe valvular problems, but then they should be looking at surgical repair in that situation then. So
how about an age limit? I've heard of people not doing surgery because they're really getting on in years and there's so much more risk to surgery. There isn't really an age limit for ECP.
No, I mean, we've had people as young in their 30s on the bed doing ECP therapy, and we've had people as old as, well into their 90s now.
That's
doing
awesome.
ECP therapy. It's a safe, non-invasive treatment. As long as they meet those criteria that I talked about, I mean, it's an excellent treatment. And, I always smile about this part of it because diabetics are probably my number one population which they benefit the most doing ECP therapy.
Is that right?
Yeah, because I think it's some crazy stat, like 4 plus whatever out of 5 diabetics end up with cardiovascular disease. So heart attack, stroke,
Yeah.
And
It goes hand in hand.
yeah, kidney function, eye problems, neuropathy. There's so many problems that happen from diabetes. But when you improve blood flow to these patients, amazing things happen.
I want to hear about how people feel and not a little bit more about the benefits and also what you see.
Yeah.
From someone that starts the ECP, the external counterpulsation therapy, and then when they have completed their sessions and the differences. We need to take a break, though. You're listening to News Talk 770's Talk to the Experts. Joining us this hour is Diamond Fernandes with the HeartFit Clinic. Check out the website, heartfit.ca. Better yet, give them a call, 403-870-4348. That's 403-870-4348. Or long distance, 1-877-700-4348. We'll be back with more after this. Hello, welcome back to Talk to the Experts here on News Talk 770. I'm Betty Jo Kaiser. Joining me this hour is heart health expert Diamond Fernandes. He is the director of HeartFit Clinic here in Calgary. Their website is heartfit.ca. You can give them a shout and have a conversation, set up an appointment, 403-870-4348. That's 403-870-4348. Or long distance, 1-877-700-4348. 4348. That's 1-877-700-4348. So just before we were at the break, we were talking a little bit about ECP, that's external counterpulsation therapy. It is offered at the HeartFit Clinic, only place in Alberta you can get this type of therapy. Before Diamond opened up the HeartFit Clinic, people that wanted this type of therapy to improve their heart health or recover from heart disease, be healthier, they had to pay big bucks to fly down to the States and get it done. Because this has been, ECP has been around for a long time in the U.S. and other parts of the world.
Yeah, it's getting close to 20 years, maybe more. Yeah.
Well-proven therapy.
Yeah.
For people that have had bypass surgery or a heart stent, they can still have ECP?
Absolutely. I mean, so unfortunately, sometimes with bypass patients, I'll start off with that. So with bypass patients, what happens is they can take an artery that's in the shoulder and they bypass that. They can use that artery to bypass a blockage. It's called a mammary artery. We see really good, when I say patent, it stays open.
Right.
So it's a really good artery to use. Now, sometimes they harvest grafts from the legs.
Right.
So they harvest veins from the legs and they bypass that. We see blockages with those very quickly within, sometimes, under 5 years.
Really?
Yeah, under 10 years for some people. It blocks up very quickly. And your heart does a really cool job that if it's blocked, it starts to try and naturally bypass on its own. So for those patients who have done bypass surgery, ECP therapy is just a better way to improve collateral flow, to improve the flow of the arteries.
Now, when we speak of heart stents, earlier you said they're an important approach if you're in the hospital.
Yeah, if it's
an emergent.
Yeah.
But how long do they last?
It depends what you're doing, of course. I mean, the actual stent itself will last, forever. The question you should be asking is, how long will it keep the artery open?
How long will it keep the artery open, Diamond? And it's only one artery.
Yeah, it's only a small section of the artery. And that's the thing, is that if you have disease on a small section of the artery, so I've seen them close up very quickly. There's probably a 10 to 15% failure rate. And then after that, sometimes it's around the 5 to 7 year mark where I start to see In my opinion, like some patients that start to come back and they start to close up again.
Okay.
When they close up again, obviously you start to feel symptoms. So it's actually a nicer way to feel it rather than actually have a heart attack. Now, you're still at risk of a heart attack. And stents don't prevent you from not having a heart attack. So that's another thing.
That's right. It's not preventative.
It's not preventative. And so that's why it's so important to obviously do what we practice at the HeartFit Clinic, talk about lifestyle changes, exercise, nutrition, keeping stress under control, and then ECP therapy. And so ECP therapy is a great treatment option because if you have that one heart stent, more than likely you got some other blockages going on. And remember, there's two things that with ECP therapy, what it does. One is it improves blood flow. It grows new arteries and improves blood flow. And it also heals the lining of the arterial wall. And so, and that's something that's really huge because the majority of heart attacks actually occur with blockages that are less than 50%.
Wow. That's really something.
Yeah.
So just to double back, if I go to my doctor and get the basics, sometimes I may be referred to a cardiologist.
Yeah.
But their toolboxes are limited.
Yeah, I mean, cardiologists are great if you're at risk.
Yeah.
I think from a preventative side of things, unfortunately, I don't think we do as great of a job because, I would go more into what you can do to make sure you don't ever have to come see me again, ever.
Right.
Doesn't matter when. Not giving you a clean bill of health just based on one test.
And
right?
that's why you have the HeartFit Clinic. That's why you exist. You found a gap and you're filling that gap.
Absolutely, yeah.
You do the more in-depth assessments. You have the conversation with people that have either experienced problems with their heart or they're worried they might. Mm-hmm. Maybe it's in their family history. Maybe they, like you say, they have some chest pain. The HeartFit Clinic is really filling a gap.
Yeah.
And between all of the assessments and the programs from nutrition, stress, I know you've said stress management is very important. Of course, exercise. The people at your clinic are really all focused on preventing and healing as opposed to just coming in and emergent situations. And so, I mean, you've said before, we have fantastic.
We've got some of the best in the city, in the world, in terms of how we treat cardiovascular disease. Heart attacks, strokes, Calgary's where you want to be.
For sure.
Absolutely.
Yeah, cutting edge.
It's after that, or to prevent that from happening. No one, in my opinion, should be having an angiogram on a preventative basis because it doesn't make sense.
Right.
There are better treatments out there before going down that path.
That's right.
I've heard of many people having heart stents and bypass surgeries on preventative levels, and that's just silly in my head because there's so many other things that you can do, like external counterpulsation therapy, lifestyle changes. Those are so much more important. Changing some key supplements to be able to help with where you might be deficient. Those are so important things to kind of look at.
You're listening to News Talk 770's Talk to the Experts. I am talking to heart health expert Diamond Fernandes. He's the director of HeartFit Clinic here in Calgary. Heartfit.ca is their website. You can call them at 403-870-4348. 403-870-4348. Long distance, 1-877-700-4348. 1-877-700-4348. Again, the HeartFit Clinic, leaders in cardiac rehabilitation, maintenance, and prevention. And of course, ECP, external counterpulsation therapy, really important therapy that's offered because it's the only place in Alberta that you can get ECP. Before you opened the clinic, Diamond, people would have to fly down to the States to get this done.
Yeah.
And you've said some parts of the world, ECP is like a frontline therapy.
Absolutely. Especially in the Asian countries, like China, Japan, Vietnam, in that area, they'll throw people on the bed while they're actually having a heart attack.
Wow.
Yeah. And it's their first line of treatment because doing angiograms and stents and bypasses in that part of the world is expensive. And so, it's a nice, safer way less invasive way to kind of help them. And if they stabilize them, that's great. It's all about stabilizing the heart.
Right.
And, when so with cardiologists and they're doing someone who's got what we call an, ECG changes, we see them, obviously that's a heart attack. If they're having some ECG problems and they find themselves in an emergency, they're actually having a heart attack, they're going to see ECG changes. They actually normalize when they put the heart stent in. And that's the whole goal of putting a heart stent in because you're restoring blood flow. There's, when you're looking at ECP therapy, if we can improve blood flow without having to do that, that's great. But we don't do that on an emergency level. That's not our focus.
No.
Let the cardiologists do that aspect and let them deal with the emergency side of things. They're great at that. What we're focused on is natural, safe options for people that do that. So if someone's coming down, and this is where, you're trying to navigate heart disease, I think we fail strong at, and I'm giving us a big F in how we treat heart disease from that perspective. So if you go to your doctor and you say, okay, I want to get my heart checked, or I want to see, I'm getting some chest pains, it's non-emergent. I think you're being sent down a path that fails us.
Right.
Where we do a stress test, an echo, and even if you fail a stress test or pass a stress test, I don't like those other two options, because now you're headed towards radiation and other tests that may not be necessary or may be unnecessary at this point. A better treatment option is to look at people's health and say, okay, look, you are at risk or not at risk, and treat them. And if they're having chest pains that are non-emergent, ECP therapy is a much better treatment option. I'd rather do that than to get a stent all day long.
I love the great information at the HeartFit Clinic, and you'll find that out when you go and spend some time with the folks there, make an appointment. Diamond showed me this awesome diagram of all of the benefits of ECP. So besides what we've talked about today, brain. The oxygenated blood gets pumped into the brain, grows new arteries, and as a result, memory and clarity improve. That just sounds fantastic. Vision. Arteries behind the eye receive increased oxygenated blood flow during EECP. People report that when they visit their optometrist, he or she has lowered their prescription for eyeglasses.
Yeah, it's when you restore blood flow, you get so many different things. And that's why I said, with diabetics, because they get so many concerns with blood flow to different areas, eye function gets better. They can see better. They think better. There's so many. So I had the opportunity, maybe I'll share in the next segment a little bit more detail, but I had the opportunity to go, if you haven't seen this documentary, you need to see this documentary. It's called Billions in Change.
Okay.
And it's,
just Google it?
Yeah, just Google it.
YouTube, Billions in Change?
Yeah, just go on Google and YouTube or whatever, and Billions in Change. And it's about this billionaire who's giving most of his money away doing these philanthropic, call them business ventures. And one of them is ECP therapy.
Cool.
And the benefits that they're doing, the research that they're doing extra to kind of see what happens with ECP therapy, they're trying to do them on athletes. They're trying to do it on patients who have concussions. They're trying to do it on patients that have, obviously neurological concerns like Parkinson's or dementia, Alzheimer's. That they're trying to really get into the open, because when you improve blood flow, so many good things happen. And heart disease is a blood flow issue. So if you have coronary artery disease, which is obviously can relate to a stent or bypass surgery, or you might be given medical therapy, or if you have heart failure, when you improve blood flow, we're going to see great things happen. We're
going to hear more about that. We do have to go to break. You're listening to Talk to the Experts on News Talk 770. Diamond Fernandes is here from the HeartFit Clinic, heartfit.ca, 403-870-4348. We'll be back after this. Hello, welcome back to Talk to the Experts here on News Talk 770. I'm Betty Jo Kaiser, and joining me once again, Diamond Fernandes. He's the director at HeartFit Clinic here in Calgary. Heartfit.ca is their website. You can reach them by calling 403-870-4348. That's 403-870-4348, or long distance 1-877-700-4348. That's 1-877-700-4348. So we're just going to double back, and because I get so excited about talking about this ECP, this external counter pulsation therapy, which is a very important therapy that you offer at the HeartFit Clinic, Diamond. And we focus on it because you've seen incredible results, and it's the only place that you can get this treatment in Alberta.
Yeah.
So when it comes to improving our heart health, we can easily access nutritionists and exercise programs. There's lots of ways to try and get us moving, but you guys specifically focus on prevention and cardiac rehabilitation, like it's all heart health. And a big piece of that is this ECP therapy. So before we talk a little bit more about it, because I can't get enough of it, it's so interesting, it's so cool.
Yeah.
Your clinic, first and foremost, you offer in-depth assessment.
Yeah. So if someone wants to know what their risk is of a heart attack or stroke with more detail, I mean, if someone used to smoke or is smoking, if someone has high blood pressure, diabetes, if someone has high cholesterol, that's a huge population that, sometimes they're taking a cholesterol-lowering medication on a preventative basis. I'm not a big fan of that. I'll be honest with you. The literature doesn't support that as well as what we think it is. And so that's things that we'll educate you when you come and see us. And even if you don't do an assessment, I'll talk to you about, our nurses or our staff will be able to talk to you about what will be the best options for you to truly prevent and reverse heart disease.
So fantastic in-depth assessment. You also offer programs, nutrition, exercise, stress management, all very important parts of heart health.
Of course, yeah, a lot of education. I talk about it as being our 3 E's. So we talk about education, educating the patient on nutrition and lifestyle changes, supplements, nutrition, stress management, all that part of it. So that's the education piece of it. Then exercise. Exercise, I feel, is the best medicine for people. And some people have difficulty with it. Some people don't. But the point is that it's truly a really great medicine for heart disease. And external counter pulsation.
The third of the 3 E's.
Yeah.
And let's just tell the folks again exactly what it is and how it works. Because it sounds kind of fancy. It sounds kind of new age. It's actually been around for many, many years.
Yeah.
In the U.S. and other parts of the world. It's an FDA approved, non-invasive. Tell us exactly what it is.
Yeah, so patients lie on a bed and they have these blood pressure cuffs that go around their calves, their thighs, and their buttocks. And it sequentially pumps blood back up to the heart. It kind of feels like a massage.
Okay.
Yeah. And so it pumps blood back up to the heart every time your heart beats. And so basically when the cuffs contract, your heart relaxes. And when the heart contracts, the cuffs relax. And that's the counter pulsation flow that is actually happening. And so we see amazing benefits from that. So patients lie on this bed for an hour. They lay on there for an hour and then they see really great options to be able to help them with their health that way. So
how many times do you go once a week?
Yeah,
or
so we
more
like
often?
to see often treatment, especially if they have chest pain or they're trying to reverse a disease that's going on. We recommend 35 treatments. That's where the literature shows. It's a very evidence-proven treatment. It's not something that we just made up yesterday. There's a lot of research showing the benefits of what ECP does. And more importantly, I've seen it firsthand. I mean, I was exposed to it the first time. So I used to work at Total Cardiology Group. That's where I started my career. And then it's a very conventional approach to heart disease that way, just kind of focusing on that. And then I got recruited to go to Dubai. And that's where I was exposed to ECP therapy. And I started to see benefits of patients there. And it was really cool to see that, that side of it and what it does to patients. And so when I got back from there, basically I opened up the clinic in 2007. So it's almost coming up to 10 years now. And it's been quite a fun ride. And always wanted to bring in ECP therapy. So we did that a few years ago now and are seeing amazing benefits with patients.
Tell us about that. Tell us about a patient or two that comes to mind when you think sort of the before and after.
I mean, we are at the Trico Center right now. And so there's a parking lot there and you go up a ramp that you have to go up to before you come to our clinic, the HeartFit clinic there. And we see people who can't even make it up that ramp when they start their
They're really struggling.
They struggle to even just make it up that ramp or struggle to make it in from the parking lot even. And after their treatments, they're able to run up that ramp almost.
Wow.
I mean, it's a little bit over exaggeration, but they can go up that ramp without having to stop.
They have their energy back.
They got their energy back. They got improved blood flow. They got improved circulation. They feel better. They're starting to sleep better. All these good things start to happen when you start to do this treatment.
You were saying 35 treatments of an hour each.
Yeah.
Over how much of a time? Like, you try and get them in every day?
We try to get them every day. So we'd like to complete the process within 2 months there. So,
And how long does it take to get in for an assessment?
So, we're usually booking in a couple weeks before getting an assessment there. And so, our assessments are really cool. So the idea is that if someone wants to find out what their risk is of a heart attack or stroke, they come to our HeartFit clinic to see, we go through our assessments. So we look at, just to summarize those very quickly, we look at artery screenings, we look at artery function, we look at the age of the arterial wall. We do some extensive blood work to look at particle size. So if you have high cholesterol or low cholesterol, it doesn't matter. The point is, it's all about the size of the cholesterol. Remember, the smaller ones are more dangerous.
Is that like the type of cholesterol?
Yeah, so we're looking at the smaller size cholesterols. And we look at key inflammatory markers to heart disease and some places where you might be deficient in terms of micronutrient deficiency. So all those things that we're able to do in our assessments. And we also do a clinical fitness assessment. That's a test to find a safe level for people to be exercising at. And so that's part of our assessment. A lot of people who want to know what their risk is of a heart attack or stroke will do that assessment. And we get a lot of people who already have heart disease, or who already have a stent, a bypass, heart failure, it depends on their disease process, but they might want to do those assessments as well to keep track of their disease process. There's so many patients that we keep track on a regular basis to see where they are. And so that's kind of what we do at the HeartFit Clinic, is to kind of keep track of people's assessments, keep track of people with assessments and education that way. And then, of course, at the HeartFit Clinic, we do exercise, clinical personal training is the best way I can say it. So our nurses, they monitor blood pressure, ECG, heart rate, oxygen levels, and we do it on a personalized approach. So people get the attention that they deserve, especially after a problem like that. And
must be very motivational too. Because it can be hard to get up and get out and get moving.
Yeah. And then, of course, with ECP therapy, it's amazing. I mean, it's fun to see. It's really fun to see the benefits of what people have. They're able to exercise, they can climb a flight of stairs without any chest pain. They're able to do a lot more, and that's really what it's all about, is improving quality of life.
So if I'm to call in the next couple of days, I'll probably get an assessment in a couple of weeks. Yeah. And then when do those results come back?
So they come back within a week. And
it's pretty quick. Yeah, pretty quick turnaround.
Yeah. And so, if someone already has chest pain or angina, then we can get started into the ECP program, because that's what we do.
It's a specialty, because it's the only place that you can get that treatment in Alberta at the HeartFit Clinic.
Yeah, and if someone's going for what we call a nuclear stress test or a myocardial perfusion test, those tests are designed to see what your risk is, if you have any blood flow limitations, and it's a good test to do, but also it's not one of my favorite tests to get done. There are better things out there. And, a lot of times people come talk to us as to how do we navigate the heart system? How do we navigate this part? Because if you're finding out what your risk is of a heart attack or stroke, let's say you have some chest pain or you have something irregular heartbeats, whatever it might be, and you're going to see a cardiologist, unless it's emergent, I don't think we do as good of a job. Mm-hmm. Yeah. Mm-hmm. And so, it's important to look at other things, is to see where and why you have a problem. Why do you have hypertension? Why do you have these irregular heartbeats? Why do you have these chest pains? And then, of course, provide the solutions to that.
We have to wrap up very quickly here, but before we do, I love this chart. And when you go to the HeartFit Clinic, I don't believe this is on the website, but when you call them and make an appointment, again, 403-870-4348, they can walk you through this. Arthritis and joint pain. You talked about sleep, the lymphatic system, libido, stamina, energy. I mean, it seems this ECP really is a whole body, health treatment.
Yeah.
It really is.
And obviously we're focused on heart, but that's our main focus. And from a heart perspective, I mean, when you see the growth of new arteries and the improved function of the artery, because remember, your artery is a muscle, it's not a pipe. And thinking about it that way and changing our perspective on that part of it is very, very important. It actually irks me when cardiologists say, your pipes are all fixed, and that's wrong, because it's a muscle. And a muscle can break down very quickly, especially if you put a stent in there. It's your arteries aren't designed to take these foreign objects and these surgeries, and it's fine on an emergency level. But if it's not emergent, that's where the HeartFit Clinic can help people out.
Okay, you got to give them a shout. We are unfortunately out of time. Heartfit.ca is where you can get more information. Give them a call. Make an appointment. 1-877-700-4348 for those of you out of town. That's 1-877-700-4348. In town, 403-870-4348. That's 403-870-4348. I'm Betty Jo Kaiser. This has been Talk to the Experts.